Back again. So we're going to carry out the knee examination. And remember, our script is wiper plus low fins. Now, the very first thing you want to do is to quickly ask the patient to walk, gait, three angles, assessing for any abnormality, whether there's antalgic gait, and all of the abnormalities. There's so many videos on YouTube already dealing with those. Now, with that said, once you've assessed the gait, you want to lie the patient down, like I have done in the previous video. And now you want to move into feeling. There are a few things some people would suggest. So it depends. So oftentimes you may want to measure the muscle bulk before, or you may want to start with temperature. So let's start with temperature. So you want to feel the temperature of the, after you've looked at the joint for any abnormalities, you want to feel, differential warmth in the joint. Once you've done that, I tend to prefer to measure. So you want to feel for the patella. Let's say this is the patella, and you want to go on an equidistant, so a particular distance, maybe 10 centimeter. And then you want to measure the circumference there on both sides. Now, once you've done this, you want to feel all parts of components as much as possible of the hip, of the knee. So let's say this is the patella here. You want to feel first the quadricep tendon, and then you want to feel for the patella, and then you want to feel the medial part of the patella, and you want to feel the lateral part of the patella. Yes? So you want to do the same thing on the other side. Medial part, lateral part, you want to feel the patella, you want to feel the quadricep tendon and patella tendon. Once you've done that, you want to also do other things. You want to do the patella tap test for fluid on both sides. Now, once you've done these, you want to also, for small fluid, you want to do the swipe test. So you try to gather the fluid together and sort of try and bring it down to check for whether there's a wave. You do that, and then you scoop it down, and then you try and feel for it. Then you try and feel for it down there. So think here it will be, so you want to scoop the fluid, then you want to swipe, and then scoop it, and then feel for the fluid here. Now, once you've done this, you felt the joint while the leg is straight. You want to bend the leg now, like that. You want to bend the knee like that, and feel. You want to bend the knee and do the same thing. So you want to also feel fibula on the lateral end, feel the lateral end of the knee. You want to feel the patella, you want to feel the tendon, and then you want to also feel the medial end of the knee while it's bent. So once you've done this concludes the feeling part of the examination. You want to quickly move to movement. And the trick is, if you remember FEE, F-E-E. Now, that's flexion, extension, but the last E is hyperextension. So the first thing you want to do is similar to what you do in the hip. You want to ask the patient to do this. Yeah, you see, you want to ask the patient to do that, and then you want to ask the patient to do this. So once you've done that, the next is you want to do it for the patient. So you want to put your hand on the knee and do that. Yeah. And then do that. Of course, it's not as clear because I'm both examiner and patient. So once you've done flexion and extension, the next is you want to hyperextend. And hyperextension is easy. You want to grab the leg as straight as possible and raise on one end and on the other end. So once you've demonstrated knee flexion, extension, and hyperextension, we now move to the region of special tests. So there are a number of things to remember here. So the special tests are easily remembered with PALM. That's PALM. So that's posterior drawer test, anterior drawer test, Latchman's test, lateral collateral, and medial collateral ligament assessment, and the McMorris test. You probably should, in an exam situation, do 2 or 3 at most. So we're going to try and see how many we can do. So the first thing you want to do is the posterior drawer test. So you want to flex the knee that way, and you want to hold. So I think probably best demonstrated this way. So you want to have the knee flexed that way and put your hand like that. And you want to, when you pull towards you, that's the anterior drawer test. When you push away from you, that's the posterior drawer test. So anterior, posterior. But in the real test, you would stabilize the examiner sits on the ankle to stabilize that. In the Latchman test, you use a lower angle of about 30 degrees, and one of your hands that way, the other, and then you do that. Yeah? And so that's the Latchman test. Now, once you've done those two, the medial and lateral collateral, essentially what you're trying to do is you put your hands on one side and you move the hip that way, knee that way, and you put your hand on the other side and you move it that way. So something like that. So hand on this side, and then you move that way, hand on the other side, and you move that way. Finally is the McMorris test, which I will task you to learn. But the McMorris test typically assess for the lemniscus in the knee joint. So thank you. That should conclude the examination, where you thank the patient and prepare. So a little recap: it starts with wiper, then plus low fins. You look where you assess gait in 3 angles. You feel along joint lines. You assess the leg while straight and then while bent. And then you move. Remember passive before active, and remember fee. That's FEE. That's flexion and extension. Flexion and extension and hyperextension. And then you move to special test, where PALM is helpful. So posterior anterior drawer test, Latchman's test, medial and lateral collateral ligament assessment, and the McMorris test. So thanks for watching. Like and subscribe.